Afternoon. Is this working? Yep. Just gonna wait for a couple of people to join. Okay, so today's Instagram or Facebook Live, sorry, will be about recovery. So everything that you need to know about recovery. When talk about training or rehab, recovery is usually the second or third most thought about thing after exercise and nutrition. But recovery is an equal, if not more important pillar of training that needs to be considered. Whether you're partaking in sport or looking to recover between therapy sessions, you are breaking down your body during these sessions. So you need to not only fuel your body to be able to heal appropriately, but also rest in order to recover before you go again. People often forget that the growth that occurs doesn't happen during exercise. It actually happens when you rest. So the method by which you decide to recover will need to get you the best bang for your buck, and these methods will be discussed during this live. When talking about recovery, when talking about recovery, it doesn't solely relate to recovering from exercise, but also recovering from an injury. Immediate recovery post exercise, post injury is usually advised to follow the Pricer principle. Pricer, I'm referring to protect, rest, ice, compression, elevate, and rest. Many of you who have been injured in the past must have been here, have definitely heard this before. Ice has been a hot topic as of recently. Um, when it comes to this intervention during the rehabilitation, it is now suggested that in fact it does more harm than good. It has been suggested this anyway. Um, ice has been used to reduce inflammation and swelling, and has been suggested by clinical. Um, give me a second, something wrong. Oh, no good. Um, yeah, ice has been used to reduce inflammation and swelling, which in fact actually does reduce pain. But recent studies have shown that this reduction in inflammation and swelling, in fact, reduces the swelling. But by doing this, it reduced the amount of blood going to the area, which reduced the amount of nutrients and cells that go to the site of injury. So by using ice, it in fact slows down the healing process. Ice does, however, have analgesic effects on the injury site. So for that purpose, it is still advised. But more research is definitely needed to be conducted. So for now, the frozen peas can still be used. Rest is always one that people take too literally, as often with injury. Moving within a pain free range has been seen to have greater improvements in the success of rehabilitation long term with a reduction of scar tissue buildup. Food is often a method of recovery that often people often forget that they can utilize. Increasing their protein intake, for example, significantly post exercise has been shown to not only reduce the level of has seen to improve its level your level of recovery post exercise. So when exercising, there's a damage among the muscle tissue, which I previously mentioned, and this needs to be repaired. So an increase in protein intake post exercise is advised to facilitate this recovery and allow the body to have protein readily available to allow recovery to occur as quickly as possible. General rule of thumb is zero point 0.2 to zero point 0.5 grams of protein per kilogram of body weight, but this may differ depending on your training goal. Carbohydrates are also a very important nutritional um, nutrient to consider when recovering. Carbohydrate replenishment is also very important, especially when you're completing multiple sessions back to back. So if you're doing a session and then going home to recover and doing a session in the evening, it's very important to increase the level of or amount of carbohydrates you consume, because glycogen stores have been depleted during that first session, so they need to be replenished as quick as possible so that you can perform optimally during that subsequent session. Hydrotherapy is a method of recovery of recovery that has been very popular as of recent. Although hydrotherapy has been widely used in recovery, evidence that supports this has been largely anecdotal, but it is confirmed. But what has been confirmed is the body's response to hydrotherapy, which is increasing heart rate, blood flow, peripheral resistance, but also altering the skin, core, and muscle temperature, which all aid recovery post exercise. Contrast water therapy is a common form of hydrotherapy where people go from, you switch between hot and cold immersions. You go from a hot tub to ice bath, and you do that for a couple times back and forth, and it alters your body's body temperature and vasodilates and vasoconstricts the blood vessels. Studies have shown that this method of recovery, although reduces blood lactate levels through that vasodilation and constriction, um, does not significantly decrease blood lactate um, a lot compared to decrease blood lactate or increase performance when compared to other forms of recovery, such as active recovery. So, although it's got the glitz and glamour of being very trendy right now, it doesn't seem to have an increased level of recovery compared to active recovery itself. Active recovery is something that's also very common amongst the athletic population. Active recovery involves completing a very low intensity workout after you've performed a high intensity workout. So whether that's you doing a couple mile run and then going on a spin by just to spin your legs in very low speed, very low distance, just to make sure that there's blood in the body and trying to flush out any of the bad toxins that are there. Active recovery includes walking, cycling, swimming, yoga, and Pilates. The benefits include reducing soreness by reducing lactic acid buildup through the increase of blood flow through the muscle tissue. It allows you to maintain training intensity through being consistent. You're more likely to train if you make it part of your lifestyle. So just by being active on your rest days will allow you to keep it part of your routine. Active recovery days are a perfect way to work on mobility. So if you're someone who's an avid gym goer and doesn't take too much care when it comes to mobility before a workout because you want to keep time as a factor after work or before work, having a recovery day or rest day that incorporates active recovery means that you don't have to completely neglect your mobility when training, which is very important when it comes to staying injury free. It also preps. Active recovery also preps the body for the next session. If you're physically and mentally drained from going all out when you're training, an active recovery session should be incorporated into your plan to not only reduce the chance of injury, but also recover properly before the next tough session. There are potential drawbacks, however, including active recovery is generally regarded as being very safe, but if you do train too hard during a set active recovery session, then you are in danger of overtraining, increasing that risk of injury. So a lot of times people can't differentiate an active recovery session from a normal session, so they might just increase the intensity of their active recovery day or their rest day, just to make up from lost reps or lost sets that they had. So if, for example, they had a rubbish workout on a Monday and their rest days on a Thursday, they might think, okay, let me catch up on the lost volume that I had on Monday. But in fact, that defeats the whole point. You need to use that rest day to actively recover, get that blood back into the body, get it into those muscles that have been used throughout the week, and try and flush it from all the toxins that are causing any sort of soreness and impairment of future activity. Active recovery should be completely 50% of your normal volume and intensity. So it is in fact a recovery tool rather than a day to catch up on missed workouts, like I mentioned. Stretching is also a recovery tool that has been used by both clinicians and PTs. But when looking at literature into the literature surrounding this form of recovery, it is concluded that there has been a mixed report regarding the benefits of stretching as a recovery strategy. However, two separate reviews of recovery methods concluded that there are no benefits from stretching as a recovery modality, but it is important to note that there have been no detrimental effects of performance associated with post-exercise stretching. So although there aren't a lot of benefits when it comes to stretching, what should be noted is that there's very little drawbacks when it comes to stretching. So having the ability to be mobile and move within a full pain-free range is very important. So incorporating that into either your daily exercise routine or your rest days is very important to stay healthy and injury free. Another form of recovery is massage and myofascial release. So massage is a widely used method of recovery for athletes to ease both muscle soreness after training, but there are only a few reports of benefits of massage on repeat exercise. Um, when talking about myofascial release, it doesn't only mean massage; it also means foam rolling and any sort of trigger point release that you might be getting as well. Foam rolling has been found to be a good adjunct to be using for increasing flexibility. There have been studies that have shown that there have been some increase in athletic performance afterwards, but when it comes to recovery modality or recovery method, massage and foam rolling, for example, hasn't been shown to directly affect your ability to recover. It has shown to reduce muscle soreness, increase flexibility, and therefore increase performance that way. But for a direct causal relationship, there is very little research that shows that massage and other forms of myofascial release has a benefit on recovery. Several reviews of the effect of massage have concluded, however, that while massage is beneficial in improving physiological aspects such as flexibility and range of motion, most evidence does not support massage as a modality to improve recovery or functional performance. However, as massage may have potential benefits for injury prevention and management, massage should still be incorporated in an athlete training program for reasons other than recovery. So, like I mentioned, even though it doesn't have direct causal relationship when it comes to increasing recovery, it should still be a method that's used widely, especially amongst the athletic community, to maintain a level of flexibility, range, and keep that muscle soreness to a minimum. Where muscle soreness is always seen to be as a reason to reduce training volume and training intensity, and if that continues for a prolonged training block or prolonged period of time, then your output during training will be significantly lower. So to prevent that from happening and prevent any injuries further down the line, that should definitely be something that's worth considering um, when training during a prep phase or even when during recovery. When it comes to a lot of times when it comes to being injured, you've probably spent a long time being immobile. So those first couple sessions of mobility, you'll feel a lot of soreness because fundamentally soreness is only there when your muscles have started to struggle to deal with the demands of the environment. So in this scenario, it's the demands of rehabilitation where it's going to be tough the first couple of weeks, and to be fair, throughout the whole rehabilitation process, where you're going to be pushing the boundaries of that injured site, along with the sites above and below the joint that's affected. So having massage as a tool to maintain a baseline level of myofascial release and make sure that there is a baseline level of flexibility and range of motion throughout is a very important tool that's used by clinicians and self-administered through foam rolling. Sleep is also one method of recovery that often people don't put as much importance on. Muscles and tissues rejuvenate when we're asleep, so you don't see um, people gaining muscle and getting coming off the injury table just by doing exercises. It's always from what they do in between sessions, how they recover, how they prepare their body after and in between sessions. That's going to be key. So muscle and tissue rejuvenate when we sleep. So if you're not sleeping enough at night, then your body will not be able to recover properly, and it will be subsequently harder for you to bounce back between sessions. As you fall deeper into deeper sleep stages, your muscles will see an increase in blood flow, which brings along oxygen and nutrients that help repair and recover muscles and regenerate cells. Hormones also play a role in this. When your body enters deep sleep stages known as REM sleep or non-REM sleep, the pituitary gland releases growth hormones that stimulate growth and muscle repair and growth. The body doesn't get enough. When the body doesn't get enough rest, the secretion of the growth hormone declines, and it can be harder for your body to recover from the injuries. The hormone prolactin also plays a part, which helps regulate inflammation and also which is also released during sleep. If you don't get enough sleep, you're more likely to experience inflammation in the body, which can make injury recovery more difficult while also putting you at risk of further injury. So it just shows that there are so many moving parts when it comes to recovery. Just trying to figure out what method suits you the best, what method helps you achieve your goal. So whether that's hypertrophy, whether that's running a marathon, whether that's recovering between games as an athlete, figuring out what you can do consistently and getting your body used to whatever method you're using, whether that's before or after exercise, is a very key component that needs to be considered when exercising. Like I mentioned at the start, if injured, the initial protocol is always going to be rest, ice, or protect, rest, ice, compression, and elevation. But um, that resting aspect needs to be taken with a pinch of salt, where people completely debilitate themselves and take um, that rest word quite literally, where you need to actually move the muscle or move that joint within a pain-free range so that the fibers can be laid appropriately. So we use the example of if you have a scab on your knuckle and you bend your finger the whole time, the scab will form in that plane. So and then as soon as you straighten that finger, it will break again. It has to reform. So similar with any other injury in your body, you have to keep a certain level of pain-free movement within, depending on the injury, of course. But the general rule of thumb is just to have some sort of active range, if not possible, active and passive range, um, maintained throughout the beginning stages of rehabilitation, just so that that initial laying of fibers can be maintained and laid in an appropriate direction, so that when you start moving with a greater range, there aren't there aren't fibers being laid haphazardly, which can cause an increase in scar tissue buildup, which will be inhibitors when moving later down in rehabilitation. So these are all things that should be considered. Um, there are obviously many more methods of recovery, but what I found myself working with clients and other athletes along the way is everyone's got their way to recover. They've just got to figure out. It is, unfortunately, it is a um, trial and error thing. One thing that needs to be consistent is sleep. That's non-negotiable, and you need to make sure that you have not only a good amount of sleep, but that sleep is quality sleep. So, like we said, if you get into that deep sleep stage, or that non REM sleep stage, that's when your body recovers the most. So, finding a way to get you into that, so practicing good sleep hygiene and ensuring that you are getting good, consistent night's sleep, especially pre and post exercise, is crucial. All the other modalities of recovery, like I said, is a trial and error process, but they do all have a place, even if the studies don't show that there's a direct correlation with increase in performance between sessions and sessions when using certain modalities. But it is very important to figure out what you can do consistently, and what works best for you, and do it as often as you can. Just make it into part of the routine. Like we mentioned earlier, mobility is often neglected when training, but making sure you have a little bit often is way better than having 30, 40, 50 minutes of mobility one day a week, because you're more likely to miss that compared to just having a little chunk spread out throughout your session. I'm going to hang around a little bit for any questions. If you've got any questions and you're watching this later down the line, drop it in the comments, and I'll try and get back to you as soon as I can. Okay, so like I said, if you're watching this at a later time and you've got any questions, drop it in the comments and I'll get back to you as soon as I can. Enjoy the rest of your evening and I'll hope to see you soon.